adolescent girls, WIFAs and such, general population with fortification, nutrition governance. We provide technical assistance to many countries, maternal and newborn nutrition, and child survival. So you saw this slide from Gertrude's presentation, but I just want to highlight that again, the strategic framework for anemia was informed by the landscape analysis that I'm going to present. So the report of the analysis, of the landscape analysis, has a background. It provides data on the prevalence of anemia, data on the etiology of anemia. There's some data as much as we were able to find on policies and programs and conclusions. I'm just going to present prevalence of anemia and the etiology given the length of the presentation. And you've already saw some version of this as well, but just to highlight that in Africa, anemia in women of reproductive age has been stigmatized. So I'll just summarize that there's been little change between 2011 and 2019. Anemia is moderate or severe across our regions, taking into account, as many have mentioned, that most of the surveys use capillary blood, and it might be overestimating. The highest prevalence appears to be in Central and West Africa. So Marilena presented a much more complex framework for the etiology of anemia, but this comes from a figure in the Global Comprehensive Framework that Lisa presented earlier this morning. And this is just to show that I'm going to focus the presentation mostly on the direct causes of anemia. So as you will see, this table summarizes micronutrient deficiency data. And you will see there that there's lots of empty boxes. That in itself is a finding. And the prevalence for micronutrient deficiencies really have a wide range across countries for different population groups. Anywhere from, let's say, iron 7 to 39%, depending on the population group. And the same for the other micronutrients. So I think the main takeaway is that there's a lack of data, one, and two, that we have to acknowledge that there's a wide range of prevalence across micronutrients and across population groups. So now stepping into more the infection, inflammation, and chronic cases, and specifically about malaria, you can see in the map the incidence per 1,000 population. This is data from 2021, and the source of most of this data is WHO's Global Health Observatory. But we know that 95% of global cases do happen in Africa, and it's a major cause of anemia in endemic regions. And children under 5 and pregnant women are at greatest risk. By the way, the report provides tables with data for all the countries by as much as possible by population group. For hookworms, again, there's the map that shows the severity of hookworms. In this case, using the proxy of the number of children requiring preventive chemotherapy for helminthiasis, again, data from 2021. And we know that at least in 2021, around 200 million children in Africa were estimated to need chemoprevention for hookworms. Again, map shows the number of individuals requiring preventive chemotherapy for schistosomiasis as a proxy of the burden. And in 2021, around 100 million people were affected globally, and 90% live in Africa. HIV, the prevalence of anemia among individuals with HIV can be anywhere from 40 to 50%, and around 26 million people in Africa lived with HIV in 2021. TB, Africa hosts 20% of the global burden, and anywhere from 25 to close to 100% of individuals with active pulmonary tuberculosis exhibit anemia. Another word I have difficulty saying, gynecological and obstetric conditions. We know that menstruation increases iron needs. Heavy menstrual bleeding affects 20 to 40% of women globally. There's no specific data that we were able to find for the Africa continent. And regarding postpartum hemorrhage, up to almost 11% of women giving birth, in Africa do experience PPH. Regarding inherited red blood cell disorders, there is really, like others mentioned, no global database. It's not measured frequently in surveys, but we found a couple of reviews, if you will, that had modeled this. The reviews said that around 18% of Africa's population carries the trait for genes for RBC disorders. And that these account for around 15% of the global anemia burden. So just to give an overview of the direct causes of anemia again, our deficiency in different population groups can range from 2 to 40%. Folate and B12 deficiency in adolescents and women can be an important factor in some countries for anemia. For malaria, around 95% of the global cases occur in Africa. It's the major cause of anemia in endemic regions. Hookworms, about 25% of infected children live in Africa. Schistosomiasis, 90% of infected people live in Africa. HIV, around 26 million people in Africa lived with HIV in 2021. Tuberculosis, Africa hosts 20% of the global burden. Gynecological and obstetric conditions, heavy menstrual bleeding affects 20 to 40% of women globally, up to almost 11% of women giving birth in Africa experience postpartum hemorrhage. And regarding the inherited RBC disorders, 18% of Africa's population apparently carries a trait for these disorders. So I'll just give a very brief background of the intermediate risk factors. We looked at the basic causes, intermediate and underlying. It's all in the report. So regarding food insecurity, about almost 430 million people in Africa in AU member states have moderate food security or had moderate food security in 2021. Need for family planning satisfied with modern contraceptive methods ranges anywhere from 20 to 87% coverage. Pregnant women receiving at least 4 ANCs. There's a range as well among countries from 24 to 87%. Coverage of RMNH services, which is an index score developed by the WHO. The average for Africa is 50 over 100, and it can range anywhere from 17 to 86%. Finally, population using safely managed drinking water services on average is 34%. Of course, there will be a range in there. And population using safely managed sanitation services, it's 26%, also with a range across countries. And now I'm going to the details for the underlying risk factors, but all of us know here that poverty, gender inequality, low education levels, climate change, chronic droughts, and conflict are underlying risk factors. So to summarize, anemia prevalence appears to be moderate to severe across all regions. Again, noting that this is based on capillary blood, which tends to overestimate. Highest prevalence appears to be in Western and Central Africa. The main causes will vary by setting and population group, and this is important. Intermediate and underlying risk factors are also prevalent. There's data gaps, especially for direct causes of anemia, for example, migrant status. There are many policies and programs to address anemia already in place among AU member states. There's a need for multi-sectoral integrated cause and anemia action plans that are contextual. And maybe let me just finish by saying that the intent of this landscape analysis is not for countries to just use this data and make decisions, right? This is just, let's call it an initial phase, so that they have an idea, and when they look at their own individual data, they can use this to draw as a first point, if you will, to do an action area number one, right, which is analyzing causes of anemia. And finally, just to acknowledge my colleagues who participated in this analysis: AUC, Gertrude and Priscilla, from NI, myself, Alison Milden, Jackie Kungu, and our consultant Mavuto, and from WHO, Lisa Rogers, Hannah Bekele at the regional office, and Mayur Mandali. Thank you so much.